my dear. So we will be discussing about the topic of gout today. Okay, we will discuss about gout कि gout है क्या. First of all, you need to understand कि जो gout होता है, these occurs due to the increased level of the uric acid. Okay, fine. तो ये किस वजह से होता है? uric acid की वजह से. I will explain each and everything for you. Okay, fine. Now listen very carefully. जब uric acid बढ़ जाता है body के अंदर, so that will convert into monosodium urate crystals. Okay, I will tell you. अच्छा, तो बुक में क्या है कि recurrent attacks of acute monoarticular arthritis resulting from intra-articular deposition of monosodium urate crystals, right? अब ये monosodium urate crystals क्या है? I will explain in detail. Fine, okay. Caused by disorder of urate metabolism, either due to increased production of the uric acid or reduced excretion of the uric acid, right? और इसमें क्या क्या risk factors है? Male sex, obesity, postmenopausal status in women, and binge drinking, right? Now listen very carefully. For example, this is a diagram, right? This diagram is actually showing a person. Okay, this is the stomach, ये blood vessel और liver वगैरह. अच्छा, तो क्या है? This person normally he eats meat. Okay, right? Red meat especially. ये है आपके पास क्या चीज़? रेड मीट. ओके, ही नॉर्मली ईट्स रेड मीट. अब रेड मीट खाने के बाद रेड मीट के अंदर क्या होता है? लिसन वेरी केयरफुली. ओके, दीज रेड मीट गोज इनटू योर माउथ, ओके, एसोफेगस, एंड देन इट कम्स इनटू योर स्टमक. फाइन. सो दिस इज आवर रेड मीट. अंडरस्टूड? रेड मीट क्या होता है? रेड मीट की जब ब्रेकडाउन होती है, सो दिस विल कन्वर्ट इनटू द purines. Okay, it will convert into purines. Understood? So these purines will be absorbed into your blood. Okay, and these purines come into your circulation. Simple. Okay, see, now this purine has come into the circulation. Okay, fine. This purine has come into the circulation. From circulation, from our blood vessels, this purine through the portal circulation, it will go into the liver. This is something very obvious. Okay, everybody knows it goes into the liver. अब liver में जाने के बाद ये जो purine है, these will be converted into hypoxanthine. Okay, these will be converted into hypoxanthine. Fine, these will be converted into hypoxanthine through enzymes. Okay, and these hypoxanthine will be converted into xanthine then. Okay, xanthine, and these xanthine finally converts into the uric acid. Okay, these xanthine finally converts into the uric acid. Simple, right? And what enzyme basically helps in the conversion of xanthine into uric acid? That is actually xanthine oxidase. Okay, that is actually xanthine oxidase. Xanthine oxidase, right? So this is a xanthine oxidase. Understood? Now what happens? Furthermore, this uric acid will come into your blood. Okay, ये वापस आपके blood में आ जाता है. ये आ गया आपके ब्लड के अंदर यूरिक एसिड. अंडरस्टूड नाउ? फाइन. अब क्या है? ये जो यूरिक एसिड आपके ब्लड के अंदर आता है फ्रॉम योर ब्लड, दिस विल बी एब्जॉर्ब्ड इनटू द दिस विल बी फिल्टर्ड इनटू द किडनीज. ओके, इनटू द नेफ्रॉन स्पेशली. फाइन. सो ये नेफ्रॉन के अंदर आ गया यूरिक एसिड. ओके, फाइन. इधर थ्रू दिस पाथवे और फ्रॉम दिस प्रॉक्सिमल कॉन्वोल्यूटेड ट्यूब्यूल के सेल्स के थ्रू ये यहाँ से पेरिट्यूबुलर कैपिलरीज से ये एब्जॉर्ब होके ये यहाँ पे हमारे क्या कहते हैं इसको प्रॉक्सिमल कॉन्वोल्यूटेड ट्यूब्यूल में आ जाता है. ओके, फाइन. एंड दीज विल बी एक्सक्रीटेड थ्रू दी nephron. Okay, outside our body into our urine. Okay, so these uric acid is excreted into our urine. Understood? Okay. Mostly these will follow these pathway. Okay, पेरिट्यूबुलर कैपिलरीज में आ जाते हैं. पहले पहले पेरिट्यूबुलर कैपिलरीज से ये यहाँ से एक्सक्रीट होके ये आ जाता है हमारे नेफ्रॉन के अंदर. फिर नेफ्रॉन से ये विद द हेल्प ऑफ यूरिन हमारे ब्लड से हमारे बॉडी से बाहर चला जाता है. अंडरस्टूड? ओके, फाइन. अच्छा, अब क्या है? कभी कभी ये जो यूरिक एसिड है इसकी कॉन्सेंट्रेशन बहुत ज़्यादा होती है. ओके, इसकी कॉन्सेंट्रेशन बहुत बहुत ज़्यादा होती है. फॉर एग्जांपल मोर देन 6.8 मिलीग्राम पर डेसीलीटर, राइट? समटाइम्स द यूरिक एसिड कॉन्सेंट्रेशन विल बी मोर देन, ओके, मोर देन व्हाट? मोर देन 6.8 milligram per deciliter. Okay, more than 6.8 milligram per deciliter. Now this is too much uric acid. Okay, too much uric acid. Fine. Okay, this uric acid can be very very dangerous in our body. Fine. Why it is dangerous? Because these uric acid अब ये जो uric acid है, first of all these will, listen very carefully. Okay, this is actually the uric acid, right, which is more than 6.8 milligram per deciliter. अब इस uric acid के साथ क्या होता है? कभी कभी सोडियम आके बाइंड करता है. फाइन. ओके, we also have sodium in our blood, right? So this sodium comes and it will bind with the uric acid. Fine. Okay, when this sodium comes and binds with the uric acid, these uric acid will be converted into monosodium urate. Okay, right? These uric acid will be converted into our body into monosodium urate, right? Monosodium urate crystal. Understood? Okay. So now these monosodium urate crystal, it has the potential to go and deposit into our different parts of body, especially our joints. Okay. Especially which joint? The first metatarsal joint. Okay. Here you have your first metatarsal joint, right? So these monosodium urate crystals, they will go and they will deposit in here. Okay. This is actually your first metatarsal joint. Understood? Fine. अब यहाँ पे डिपॉजिट होने के बाद इसका पेन कैसे होगा, right? What type of pain you will experience? Trust me, the pain is very very severe. Okay, fine. The pain is very severe. Even the patient will, okay, wake up. Even the patient will wake up. Okay, he will wake up from the sleep. Okay, fine. He is sleeping and he will wake up and he will shout. Okay, he will say, I, it feels like my big toe is on fire. Okay, fine. तो इस तरह से फीलिंग आएगी पेशेंट को, इतना ज़्यादा सीवियर पेन होगा. ओके, सीवियर पेन होगा, right? Including that there will be erythema, there will be redness, there will be swelling. Fine. So these type of features you will find in these patients. So it mostly affects the first metatarsal joint. Understood? And these can actually for example involve other joints also, like ankle joint. Okay, which is present here, ankle joint not here. Okay, but it is also present in your lower limb, obviously. So your ankle joint, your wrist joint, your elbow joint, they are also affected by the monosodium urate crystals. Understood? Okay, so this is the pathophysiology. Fine. Now what happens actually, uric acid concentration is increasing, and which when it exceeds, okay, more than normal, like more than 6.8 milligram per deciliter, then it will start depositing into our joints. Okay, now why it increases? First of all, due to consumption of the red meat. Okay, red meat. उसके अलावा it can also increase due to the organ meat like liver meat. Okay, most, for example, people, they also like organ meat like liver meat. Okay, fine. So these can also increase the production of the purines in our body. Okay, right. Including that, you also have fish, right? Fish also has, a lot of the like we can say that purines. Okay, when it is broken down, so it will produce a lot of purines. Fine. Okay, so these are basically and yes, you must remember one more thing. Okay, there is like shellfish. Do you know shellfish like lobster, crabs? Okay, they are the examples of the shellfish. They also, they are abundant in the purines. Fine. So yes, they are actually, when you consume, okay, when you eat a lot of these things, then they will obviously increase the production of the uric acid. Understood? अच्छा, उसके अलावा एक और टर्म है, एक और फॉर एग्जांपल इटियोलॉजी है, जैसे कि केमोथेरेपी. डू यू नो अबाउट केमोथेरेपी? Especially chemotherapy we will do in patients. Okay, therapy, right? Chemotherapy and radiation. Now what happens in chemotherapy or radiation? First of all, you need to understand one thing. With the help of the, there are some people in the world who have cancer. Okay, fine, cancer, right? Some people have cancer. So to the cancer people, okay, we will give chemotherapy, right? Chemotherapy is actually a kind of treatment for the cancer, right? Okay, now when you give chemotherapy, these will kill the cancer cells, right? When it will kill the cancer cells, so the cancer cells will release a lot of purines, okay, into your circulation, right? And these purine, obviously these will go into your the rest of the mechanism is obviously very easy. This purine, okay, when these cancer cells will die, after their death they will release purines. These purines go into your liver. Okay, they are converted into hypoxanthine, xanthine, and then uric acid. Okay, these uric acid will come into your circulation and these will increase the uric acid. Okay, these uric acid will convert into monosodium urate and they may deposit into different joints in your body. Fine. So chemotherapy is also, it can also increase the risk of the uric acid, monosodium urate crystals. Okay, fine. Or gout. Acha. So we discussed till here. Yes, there is one more very important thing you must remember. Okay, some people actually have, chronic kidney disease. Chronic kidney, is it visible to you? Chronic kidney disease, right? Now what happens in chronic kidney disease? Normally our kidneys, our, for example, nephrons are responsible to excrete the uric acid out of our body. Simple. Okay, right? Mm, Sometimes what happens, some people have chronic kidney disease. That basically means their nephrons are not working perfectly, right? Okay, when the nephrons are not working perfectly, that basically means we are not able to excrete, okay, we are not able to push or throw out the uric acid from our blood into the nephron, right? Why? Because the nephrons are not working. So obviously we won't be able to put the uric acid out of our body. Fine. So these will also increase the uric acid in our blood, and that will lead to the monosodium urate, and they will deposit into our joints. Fine. Okay, now listen very carefully. There is actually one drug I want to tell you, okay, that is actually called as the yes, listen very carefully. What happens when these uric acids or monosodium urate, they will deposit into your joint? You know, you have white blood cells in your circulation, okay, white blood cells. So these white blood cells actually go, okay, and they will migrate at the site of the this monosodium urate crystals, okay. And when these white blood cells go there, these white blood cells will actually cause inflammation here, okay. And obviously because of the inflammation, what happens, your these first metatarsal joint, okay, it will look red, it will be swollen, okay, because there will be inflammation. Understood? Okay. So we have actually few drugs like colchicine. Do you know colchicine? Have you heard before about the colchicine? Now what is colchicine? Colchicine basically inhibits, okay, it inhibits the migration of the neutrophil at the site of the inflammation. Understood? So what, if there is, for example, no neutrophil, then obviously there is no inflammation, and that is good, okay. That is a kind of treatment. Including that, we have allopurinol. Do you know about allopurinol? What is allopurinol? Allopurinol basically inhibits the xanthine oxidase, okay, xanthine oxidase enzyme. If you inhibit the xanthine oxidase enzyme, there will be no conversion of the xanthine into uric acid, so there will be less production of the uric acid, and there will be less production of the uric acid. Understood? There will be no formation of the monosodium urate, and no deposition in the joints. Understood? Okay. So including that, sometimes we also give like NSAIDs, okay, to reduce the pain. Obviously we discussed that there will be a lot of pain, right? So we can also give NSAIDs to the patients, like naproxen sodium, okay. NSAIDs we can give naproxen sodium, ibuprofen. And if, for example, the pain is not resolving with NSAIDs, then we will go with the corticosteroids in these patients, okay. Corticosteroids also we will give. So the rest of the story, there are so many things which I did not discuss, we will see in the book, okay.